Um, Thank you also for the wonderful introduction that you just gave me. I really appreciate that. What I'd like to talk about today is the detection of biomarkers for ovarian cancer in the 40 minutes that we have. I'm going to concentrate on two particular markers, CA125, which is standard marker, and also a new one, lysophosphoric acid. One of the things that we're interested in doing in our lab is to try to use sensing, biosensing technology to detect several markers at the same time, which we call multiplexed, which I'll talk a bit about in my presentation. Detection conducted through electrochemistry, acoustic wave methods, and optical science as well. And at the end of my presentation, I'll talk about where we're going to go with the future. So just a word about biosensors. For those who are not familiar with this, the electronic device which has a probe on the surface for a particular marker in fluid. This, of course, is things like antibodies, nucleic acids, cells. We'll see later in my presentation a number of transducers that can be used, and we get electrical signals from the interaction on the surface of the device. The use of these devices has been around for about 20 or more years. Mostly interested in clinical diagnostics, detection of diseases, something we talk about today, progression of disease states, detecting infectious entities like viruses and bacteria, and monitoring of drugs, and also assay of drugs that are used in blood and urine and the like. And so we very widespread use of these types of devices. In terms of gynecological chemistry, conditions, which is what we're interested in our lab, they have been used in a number of areas. Actually, the one I want to talk about today is using these biosensors to detect ovarian cancer. But they also have been used for other conditions such as cervical, uterine, endometriosis, and also infections, gynecological infections will be used quite a lot for that. Ovarian cancer, of course, is very well known to this audience, but just because you can't see the news there, this is an advert on an Air Canada magazine that was published a year or two ago. This is Minnie Driver, an actress who I think suffered from this particular disease. As you know, these tumors develop in the ovaries and also in the fallopian tubes as well. There's also a lot of conditions involving that. Just a few words about this, for those who maybe not so familiar. You see here the 5-year survival rate is overall is about 46%. For late stage detection, it's pretty poor. 1 in 4 people survive, but in stage 1, it's remarkable. This particular form of cancer that it's actually well over 90%. So obviously, there's a tremendous amount of interest in the medical world in terms of trying to detect this disease by screening purposes at a very early stage. A statement published a few years ago, but it's sort of interesting that a report on ovarian cancer was that what we need to do is to develop imaging modalities and biomarker detection that looks at very early stage development of the disease, which is something that we're very interested in doing in our lab, which is what I really want to talk about today. There are a whole set of potential biomarkers for this form of cancer that have been sort of developed over the years. I think the latest count is probably 50 or 60 of these markers are being isolated for the disease. But of course, some of these are really not well characterized at all, and the progression of the marker of the disease is pretty well not characterized very well at all. we concentrated on one or two of these, which we'll get to in a minute. There have been a lot of biosensors that I talked about a couple of minutes ago for these types of biomarker. I don't want to go through this list here, but there have been several which we just produced a book about this after the Royal Society of Chemistry in England on all these sensors for this. We'll be talking about, of course, my work on using a sensor for a particular marker. And this is lysophosphatidyllic acid, which is serum level is about 0 to 5 micromolar. The concentration of this particular marker does in fact match the progression of these rather well, actually, up to when you get to higher stages, it gets to 50, 60, 70 micromoles per liter. It looks like a rather good marker for the disease. So we concentrated on the last 2 or 3 years on trying quite hard to detect this particular species in human serum. It's actually, if you compare it with the so-called gold standard, which is the CA125 marker, which has been around for the better part of 30 years, it actually stands up really, really well against CA125. CA125 is somebody in the audience, I'm sure, know, it is not, let's say, a particularly good marker. Actually, at the early stages, and also it has a history of, to some degree, of false negatives and false positives as well. This particular marker we worked on here, LPA, lysophosphatidyllic acid, actually is much better in terms of age progression and also at the early stage of the disease. There are a number of methods to detect this particular molecule, and many of these are looked at, such as radiometry, fluorescence spectroscopy, various forms of gas chromatography, mass spectrometry, and liquid chromatography. But of course, in terms of sort of large-scale screening of patients or the population, of course, this would be impossible because these things require generally pretty sophisticated instrumentation, and also the cost of it. They work pretty well, of course, but that's not the point. I think if you're interested in screening, and even potential going into something like the doctor's office essentially, these would not be appropriate. So not that useful. In our work, which is what I want to spend the rest of the time concentrating on, we are developing a number of different, shall we say, physics to look at detecting this molecule. We developed 3 or 4 years ago a conventional fluorescence microscope, which I'll describe in brief in a minute. We also concentrated on a very good grant from our government on electrochemical methods using square wave and differential pulse voltammetry, which I'll get to. More recently, in the last 2 or 3 years, we've had an effort to look at chemiluminescent methods using nanoparticles. Some of you in the audience might be familiar with ELISA, where they can use these magnetic nanoparticle-based strategies to do ELISA. We wanted to develop a kind of method for LPA, and so ovarian cancer, using somewhat sort of like analogous protocol for that using chemiluminescence, which I'll talk about briefly. And we also been looking at acoustic wave physics, and another entirely different type of sensing device to detect LPA. So we have basically three types of physics, if you want to call it that, in terms of trying to detect this thing, this molecule. One is spectroscopy, fluorescence, and electrochemistry, and also high frequency acoustic wave physics. They're all different methodologies for the same sort of same problem that we're trying to look at here. The chemistry that we developed acetic acid, the probe that finds this in extremely selectively. This is a protein called gelsolin. Gelsolin actually well. So in our work, what we do is we bind actin to gelsolin, and we label the actin with a dye, and the LPA comes along on the surface of the device and replaces the actin into solution, which can then be measured by fluorescence spectroscopy. So basically, the sort of cartoon of what actually happens is shown here. We have a fluorescence system. In this case, it's particles that we're doing this on. Very rapid, and we've done this in serum, in the whole serum, quite successfully, using this sort of form of simple fluorescence spectroscopy. But the problem is that the limited detection for this methodology is about 5 micromoles per liter in whole serum, which is not actually good enough for practical application. We need to get down, hopefully, to sub-micromolar in terms of concentration. If you remember, the base concentration in healthy patients tends to be around between 1, 2, and 3, 4 micromoles per liter. This method just doesn't get quite far enough down. But actually, on the funky side, the chemistry here, which tells in actin surface chemistry, it looks like it's very useful for detection. So we went into other types of systems, and as I mentioned, one of the things that we're looking at extensively is the electrochemical methods, which may not be so familiar to this audience. We have a working electrode in our work, which is in fact the stainless steel. We have a reference electrode, which is silver chloride, and basically we use various forms of voltammetry, which I won't go into the physics of this, but basically we can use electrochemistry to detect the kind of gelsolin actin chemistry that we saw a minute ago. And I have it sort of kind of summarized on this slide. You see on the left there, electrochemical data. This in fact is voltammetry on the surface, and we actually do in our lab, of course, a lot of surface chemistry here. This is what we're rather good at. We're stainless steel plate here. We have some anti-fouling chemistry that is proprietary to our lab. Basically, we can do the same gelsolin actin chemistry replaced by LPA on the surface here, and we can detect a very nice electrochemical signal. This actually works rather well, actually, even in whole serum. And also the detection limit is significantly better than the fluorescence spectroscopy that I talked about a minute ago. It's actually worked quite well. We also have developed, this is actually a slightly different technique of differential pulse voltammetry. For those of you who are familiar with electrochemistry, we do the same, very similar surface chemistry. This one's on screen-sprinkled electrodes. These are gold electrodes that we can purchase, and they're very inexpensive, just a couple of dollars each. And basically, we do all of that surface chemistry, the gelsolin actin chemistry again, yet again. There's a different type of it's a different type of electrochemical technique, and we can actually detect the same, very similar surface chemistry. We get a quite nice calibration curve for LPA detection, and basically, actually, we can get this down to the levels of stage 1 for sure in terms of the detection characteristics. So actually sort of summarizes what we've done in electrochemistry. Most of this work has actually just been published in the last 12 months. One of the things that I mentioned earlier that we're interested in sort of doing here is to have a method that sort of is analogous to the classical ELISA technique, because you know that this is used for nanoparticles, that magnetic beads there. And, it's a standard, very, very standard clinical biochemical method, as you all know. Well, we wanted to, in our lab, we got a grant quite recently to actually try to sort of copy, if you will, that sort of approach involving nanoparticles, but not in this case, not ELISA, but in fact, try to use chemiluminescence to detect the actin bound dye chemistry that we looked at maybe about 20 minutes ago. So it's actually all done on, excuse me, on nanoparticles, which we make in our lab, and find in an effort to make a chemiluminescence method that might go down sub-micromolar actually in terms of concentration detection. This is a very recent effort in our lab. It's not been published yet. We're just about to do that. We actually, these things can be rather expensive, so we actually tend to make these. We have a postdoc in my lab who's very good at making nanoparticles, so we actually do this ourselves. In our chemistry department at our university, we can make these magnetic nanoparticles rather well, actually, quite very successfully. The sort of technology is really quite similar to the ELISA world, where they're using, as you know, they're using enzymes, but in this case, we're mobilizing on the surface of these nanoparticles. We're putting down on the surface the kind of chemistry that we talked about, you know, a few minutes ago. We sort of put down all the surface anti-fouling chemistry, the program, the LPA, etc., in the second step on magnetic nanoparticles. We have the facilities to actually work on this kind of particle chemistry. So basically, what we have to do is to get in some pretty heavy-duty surface chemistry here on iron oxide nanoparticles. In this case, we used some proprietary surface chemistry that you see here. There's a paste to get down these probes on the surface, like gelselin. And this chemistry is designed actually specifically to avoid fouling on the surface from the components of serum. As you know, we have very high concentration of proteins in serum. So in this case, we want to avoid fouling on the particle surface. We're going to do this involving this surface chemistry that we see here on this slide. And we actually then put down, we can put down on the surface particle using nickel MTA histidine tags, which is a very standard technique in the world of surface chemistry, to get the probe, gelselin probe down on the surface. And eventually, this is work we just produced in the last few weeks. We can actually get a quite nice calibration curve for LPA, and this is serum, whole serum. And this methodology, which is very, very analogous to ELISA. And basically, one of the nice things that comes out of this research work is that you can detect some nanomolar concentrations, which is actually really very nice. So we're actually now, we have produced, came into the patent on this technology. And we actually have, we'll be looking at it, I'll mention in a minute some patient samples using the method. The last the technique I wanted to mention was, as I said at the beginning of my talk, is acoustic wave physics. Lab has been pioneering use of acoustic wave sensors for various forms of biological chemistry. In this case, without going into the physics of it, we can drive acoustic waves from the device into fluid like serum, and we can do surface chemistry. In this case, it's actually on quartz, it's on SiO2, and the quartz is given into a very high frequency in our case, to about 1 gigahertz, very ultra high frequency, and we can actually make a measurement of change of frequency by doing the same surface chemistry that we will be looking at in my presentation. In this case, we can actually change the frequency to make a measurement of concentration. We also use the standard quartz crystal microbalance, which is a gold electrode cage electric device. We can actually do, again, the same surface chemistry. This is a very low frequency device. This thing operates around 10 megahertz, not the 1 gigahertz of the very high frequency device. And so we actually can do on the surface of these devices, again, you can see the similar sort of surface chemistry approach that we have here for delta and LPA on the surface, and that's actually been worked out and published within ICC. We can actually detect LPA in human serum really quite nicely. Actually, you know, see a calibration curve here. So so this is just to summarize it really briefly. This is a sort of a third approach to this. One approach, of course, electrochemistry, and then we have optical method spectroscopy, and then we of course have this form of acoustic physics. Which method would be better? So it's a question mark. A few words to finish up about the future here. As you've seen in the sort of brief presentation I've been able to give here, we have different methods for doing this, and right now we're trying to figure out which of these methods would be in fact appropriate for, you know, practical use down the road. So looking at you know, real cases, it's not obvious at this point which would be the better. We're also looking at quite a lot of test assays with male blood, because there's no LPA in male blood. So we're spiking that, so we're looking at different concentrations. So doing a very careful, detailed study of concentration effects, and all those three different techniques that we've been looking at here. At the local hospital here, the Princess Margaret Hospital, they have a very sizable gynecology research unit there. Most of the people there are professors at our university as well in surgery and in gynecology. They do have samples from patients in at all the various stages, stages 1 to 4, plus the sub-stages. They have all of that available. And so one of the things that we want to do is to actually apply the techniques that we've looked at here to look at these patient samples. And also looking at, we also have a possibility now with this permission to look at what you might call fresh patients, some people who are actually in-house here with the condition. There are various stages in the hospital, and we have a chance now to use our methodology to look at their sample and do a comparison with the transvaginal ultrasound, etc. As I mentioned, one of the things that we have a grant to look at now is multiplexing. It would be sort of advisable in the future to, if we're going to use biosensors for this sort of work, would be to look at several biomarkers at the same time on a device, which of course doesn't exist right now. That's actually in the imagination at this point. Nobody has done that yet. But we are in our lab. We have a couple of students who are developing multiplex systems for looking at AT4, another biomarker for ovarian cancer, and LPA, of course, that you've heard about today, and C125, all on the same sort of, in our case, it's going to be a multiplex electrochemical device that we're using for that. Of course, in terms of practical implementation in the clinical situation, there are a lot of regulatory issues, of course, as you all know, to deal with, which we're right in the middle of doing right now. And we're hoping that within, some months or a year or two, that we can actually get permission to actually do some real measurements, which would be pretty exciting for us to actually get after this stage 1 detection of this particular disease. Okay, so I'll finish up there, and this is my email. If anyone in the audience wants to contact me, I'll be happy to try to respond to any questions. They're on this computer system here. The questions don't seem to work out that well, so that's our city of Toronto there. So thank you again for the invitation, and thank you for the wonderful introduction, Nehal. I really appreciate that.